Hey there, it's Todd Cameron here, GP and Medical Director at M3 Health. This message is to just chat to our community about the changes we're making in our general practices and why. We know that from what's gone on in other countries around the world, that there's a wave of coronavirus that is slowly making its way through the community. And what's important for us now is to actually make sure that we help as many people as we can. And my job has always been in medicine to work for the safety of my community. That's why you get into general practice, and that's why we're still in general practice. And so that's why we're making this change. You'll notice if you come to any of our practices that you are now being screened at the door, and you'll be asked two questions. Are you at all unwell? And by unwell, we mean general lethargy, tiredness, what we call malaise, cough, runny nose, sore throat, shortness of breath, fever, and gastrointestinal symptoms, nausea, vomiting, or diarrhea. Have you had any of those symptoms? If not, has anybody in your household had those symptoms? If you answer yes to either of those, you're being turned away and offered a telephone consult. Those telephone consults will occur at the same price as a face-to-face consult would for you. There will be no change in that. Our practice will sort that out. In the course of a week, over the next 4 days, we are pivoting to doing all of our consultations by phone. There should be no good reason for a patient to come into the clinic. We'll be looking after you all by telephone. That means that we are bringing into play the behaviours that we want to see in the community, reduce the circulation and spread of this potentially harmful virus in the community. Remember the things you can do to stay safe. Social distancing measures, no hugging, kissing, handshaking, 1.5 metres distance between people. If you must, cough or sneeze into the crook of your elbow. Wash your hands regularly, soap and water, and avoid touching your eyes, nose and mouth. And avoid touching surfaces that are touched by a lot of people, particularly shiny surfaces. Thanks for working with us. We're going to have an orderly transition to telephone consults. We've got plans in place to work with pharmacy to make sure you get the medications you need. We're really looking forward to working with you, our communities, and demonstrating the leadership that we know is needed at the moment. And if there's anything that you have that you want to know, put that in the questions below the Facebook feed here or in YouTube. Thanks. I've been Todd Cameron. Bye.